Welcome to the Research Training for Patient and Public Involvement members within the Cicely Saunders Institute. This training is broken down into 6 sections, with this section discussing what is PPI and why is PPI important, followed by 5 sections of the research cycle, including identifying the topic, creating the research design, carrying out the study, analysis, and finally, dissemination.
Well, I'm going to read out the NIHR definition of PPI. Public involvement in research is carried out with or by members of the public, rather than to or about or for them. That means the lived experience of a patient, a carer, family members is respected and included in any research project, and it makes a difference to the final outcome of the research.
Patient and public involvement is where we work with people with lived experience of the topics that we're researching to improve the quality and the relevance and the impact of the work that we're doing. It involves working with people as research partners rather than just as participants.
It's how we work with them to ensure that our research is asking the right questions from the very beginning, and that the way that we carry out our research and analyse our data and share our findings is in a way that is helpful and important for those people.
Members of the public or the patient share their experiences, their challenges with the researchers to inform, to offer help in what researchers can perhaps look into in order to try to help health and care services that members of the public will receive.
And ideally, that involvement should start at the very earliest part of a project or a clinical trial or some other research study. Patients themselves can be those patient advocates, but unfortunately for terminal diseases, for end-of-life care, it's going to be the carer or the ex-carer who is actually the PPI advocate.
We can help researchers build a better research by including the patient voice. It's the patient voice in research.
PPI is about involving people who our research is going to mostly affect, to make sure that we are doing research with them rather than doing research about them.
I've been involved in PPI research for 10 years now, and it's clear to me that it enriches that research process, not just in terms of designing the trial, but also in terms of the outcomes at the end of the trial or the research project.
PPI is absolutely crucial, as far as I'm concerned, to make sure that our research is relevant, that we're asking the questions that we should be asking, that we're asking them in the right way. And when we get results, to help us understand those results, because sometimes for us as researchers, we might be a little bit surprised about what we find, and we can turn to our PPI advisors to help us understanding our findings.
So PPI is important because it's how we make sure that the voices of our patients, their family members, and the public more generally are heard in our research. And that comes from the very beginning when we're designing research and making sure that we're asking the right questions, to how we collect the data, to how we analyse it, and how we share our findings, and making sure that the way that we do that is meaningful to those patients and the public and makes a real difference to them.
Without PPI involvement, so without having people who had experience of the conditions that we are conducting research on, the research is basically not as meaningful, it's not as applicable, it's less likely to be translated, so it's less likely to be actually useful in real life. Our research is for real people, and that's what PPI brings into our work.
If you have any further questions about how research works or how you can get involved in research, please feel free to contact csi.ppi@kcl.ac.uk.